Hey, welcome to the Go-To Physio podcast. My name is Dave O'Sullivan, and in this podcast, my aim is to give you 15 years of my experience in professional sport and private practice and share that knowledge so that you can get real-world results with your complex patients who have failed traditional approaches. I hope you enjoy the show. Hey, welcome to a brand new season of the Go-To Physio podcast. My name is Dave O'Sullivan. Absolute honor and privilege to have you here. Now, the new season of the podcast, the theme around it's going to be happy progressing patients. Okay, so this is my scruffled up version of my new book. And what I want to do is I want to do a podcast this season that's a little bit different. Okay, so we're going to have 4 types of episodes on this podcast. The first one, it's going to be talking about happy progressing patients. So that's where we're going to go in depth into a chapter of my book where you can really start to understand it. Okay, so again, I say this all the time to my mentorship therapists, and this was taught to me by a coach previously, is you hear information, then you know the information, and then you finally understand the information. And the whole point of these types of podcasts episodes with happy progressing patients is I want you to go from knowing the information to really understanding it, okay? So, and that's a big thing I really reiterate for my mentorship therapist is don't just accumulate loads of knowledge. Get that knowledge, organize it in a way, and then implement it in the real world so that you can truly understand it, okay? So that's the first type of episode that we're going to have this season. The second type of episode, it's going to be a Q&A, okay? So that's where you're going to ask me questions. I'll answer usually 2 to 3 questions in an episode, okay? So to ask any questions that you want answered on the podcast, you're going to go to www.thegotophysio.com/questions, okay? There'll be a form there, submit your questions, and then every few episodes we'll do a Q&A, okay? The third type of episode that you're going to get is more of a traditional podcast where I might interview somebody being completely selfish that I probably want to chat to improve my clinical knowledge also, but most importantly that I think you'll get a lot of value from, and that will help you apply the content that is covered in the interviews so that you can actually get results in the real world, okay? And then the fourth type of episode, it's just going to be a topical issue that I feel actually, you know what, it just deserves its own episode. That's not necessarily related to the book, that's not related to Q&A or an interview, okay? I'm not going to have any advertising on the podcast, okay? If you get value from the podcast, just share the show. That's all I ask, okay? So, you know, you can leave a review on iTunes or whatever it is that you're watching just to get more awareness, or just share it with a colleague that say, hey, you know what, I think you'd get a lot of value from this podcast, okay? So that's all I ask for you. I'm not going to loiter it with loads of different ads and all of that stuff, okay? I'm not going to waste your time. My ultimate aim in this season is to give you the 15 years experience that I have in professional sport, okay? Now, it's not 1 year repeated 15 times, okay? I'd like to think. It's 15 years of experience of growth, of failures, of making mistakes, of reflecting on those, and ultimately trying to improve my own structured step-by-step system. So I want to give you those 15 years experience in the real world, in the trenches, not on social media, okay? And then give you the information so that you can apply it in the real world and actually get results and get value with patients that have failed traditional approaches, okay? So that's the ultimate outcome here, okay? So I think I've covered all the housekeeping for today, okay? So with that said, the first episode is I want to talk about the big problem in the physio profession and how you and I are going to solve it together, okay? Now, one of the biggest problems is that there's a lot of patients who are failing traditional approaches. There's a lot of patients who, when we do everything that the evidence shows us, okay, and that we were taught in university, that they still have pain, okay? Now, I touched on this in my mentorship coaching calls recently, and what I said is, and again, I'm not saying this to be controversial, I'm saying it because I actually believe it, okay, is that I think when you reflect, and when I've reflected, you actually look at the training we were given in university. Now, before I go into this, some of my best mates are lecturers in universities, okay, and I have this discussion with them, and they kind of tell me, you know, from their side as well, okay? But one of the big issues is that I think that the university training we were given, it was just basically taught average therapists to survive in the profession, okay? Now that's the first thing. Now I mean that with the greatest respect to our university training and all the hard-working lecturers out there, okay? Because as I said, I'm fully aware that you've got a job to do. You have to follow curriculum. There is certain stuff that you have to be, that you have to teach. And that was one of the big reasons. I love teaching, but it was one of the things that scared me, that I wasn't too keen to go into that when I kind of heard the experiences from some of my mates, okay? Now, if you think about it, the training that we've been given, it's just given to us so that we can survive. Now, it goes without saying, your training really only starts when you actually qualify, when you get into the trenches, when you get on the job, okay? Now, if we look at how the average therapist approaches things, okay, and how we were kind of trained, or certainly how I was trained in university, it was, okay, here's the site of pain. Let's go through our assessment where it's diagnosis, diagnosis, diagnosis. Okay, let's diagnose the problem. Okay, then let's strengthen or stretch the area and then hope for the best. And then we went through this phase where there was like a glute epidemic, if you want to call it that, where everybody was getting glute exercises. I'll put my hand up, that was me too, okay? Before that, we probably had the transverse abdominis epidemic, okay? Now we've got other epidemics. Soleus is getting quite popular these days, okay? And again, you know, I've kind of probably contributed to that a little bit with the soleus slouch and all of that, okay? The diaphragm is getting more popular, okay? Again, I've probably contributed a little bit to that. My intention with the diaphragm PDF is so that you can truly understand, so go from hearing, knowing, understanding actually why stretching the diaphragm helps all these things, okay? So again, I wanted to help therapists make sense of that, as opposed to falling into the trap that I did with all the breathing exercises and just think, okay, the second that I give a breathing exercise and I change range of motion, that's it, because that couldn't be further than the truth, okay? So the reality is, once the patient goes back into the real world, a lot of these changes are going to undo themselves again. And that's where then I started to become obsessed with long-lasting results, okay? So the average therapist goes through this lens of diagnosis, 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 special test, special test, special test, spend all our energy time looking for that. Then we get to the end of the objective assessment, and then we have to shift gears where actually we have to, you know, design a treatment plan, explain the problem to the patient, get them to buy into a treatment plan, and then actually make a fast start with the patient. Okay, so there's a lot there. Now, that's okay for some patients, and I'm not denying for a second that some patients do improve, okay? The problem is that there's a lot of other patients who don't respond to that approach, okay? And they're the patients that we really need to be helping, okay? We have to ask ourselves higher level questions, okay? As I said previously, I worked with a psychologist, Carl Morris, who taught me, I think it was, he gave credit to Tony Robbins, the quality of your life will be dictated by the quality of questions you're asking yourself, okay? The quality physio that you are will be dictated by the quality of questions you're asking yourself, okay? So I've just completely bastardized that there, okay? Now, what I mean by that is we need to do this one thing that will instantly differentiate ourselves from average therapists and actually give us half a chance to actually help these people who fail traditional approaches. And that one thing is think, okay? Thomas Edison said it himself, okay? He said, 5% of the population think, 10% of the population think they think, okay? And then 85% of the population would rather die than think, okay? And it's very, very interesting when you think about that quote, okay? And you spend actual time thinking about it, you get an awareness, you reflect, and you look at people, okay? I was guilty of it myself yesterday, okay? So working with Leeds Rhinos had a guy who was about to go on the pitch, and we want to do his pre-running prep, okay? So again, go into the gym, you know, I've gone through this with him a lot, okay? And, you know, I'm big into asking questions to process information and many other techniques and tactics that I use with athletes and patients, okay? And, you know, we got into the gym and he's just looking blankly at me, okay? Then, you know, he goes, oh, what do you want me to do? I was like, what do you mean, what do you want me, what do I want you to do? You know exactly what you should do, okay? Now, I was on a stag do in Ireland and Galway at the weekend, and I had quite a few pints of Guinness. So obviously the natural banter back is, oh, you're hungover today, you don't want to do any work, okay? Now, there might have been a little bit of truth in that, okay? But the bigger picture for the athlete is, I need him to understand this because I'm not always going to be there, and he needs to take ownership for this, okay? So again, I goes, right, do what you think here, and I'll tell you if you're wrong, okay? And he paused, and then he done something, okay? He actually, what's the word, think, thinked, okay? So he actually had to think for himself, okay? And he got 90% of it right. He got 90% of the process, the pre-running prep right, okay? And now, hopefully that's going to empower him to actually be able to have the confidence to go into the gym himself and do all of this stuff without me watching every single rep and telling him what to do, okay? So that was just an example there where, like, you know, I'm guilty of it sometimes where we're spoon-feeding athletes, we're spoon-feeding patients, okay? Now, back to this problem, okay, of patients who have failed traditional approaches. How do we differentiate ourselves from the average therapist? Well, we have to think, okay? And the thing that I love about this profession and that I love about patients who have failed traditional approaches is the puzzle, okay? I get a buzz, I get that feeling inside, that feel-good feeling that we all get as therapists when I can solve the puzzle. When the patient who's failed traditional approaches can come in and I can do something, I can give the right stimulus at the right time, and the nervous system just responds, okay? They feel lighter, they move with thoughtless, careless movement, the pain goes, okay? There's nothing better than that buzz for me, okay? And it's a puzzle. But in order to solve the puzzle, we have to think, okay? And that brings me back to this new generation of physio that we need, okay? We need an innovative physio that can actually critically think. And then I went around and I had a look, okay, well, like when I'm mentoring therapists and I'm helping them to think, I always talk about this strategy. You have to have a strategy first, okay? Strategy is 80%, tactics is 20%. Now, the thing about a strategy is the strategy, there's thinking involved in the strategy. Because if you get the strategy right, the tactics, the hands-on technique, the rehab, it pretty much takes care of itself, okay? So we talk a lot about that in the mentorship. But when I actually broke it down and said, okay, well, how can I teach this better? How can I teach my own therapist here in the clinic this better, okay? There was actually some really good stuff that I came across. Now, there was one actual article towards the top of Google. Where else would you start? The University of Tennessee, and I'm going to butcher this, Chattanooga, on critical thinking. It was a really good article, and it was just like the basic elements of critical thinking. And again, for me, I always start with the basics, okay? Just start with the really simple stuff. I don't need to go too deep into this, because ultimately for me, when I'm looking at this and I'm trying to figure this out, I want information and knowledge that I can apply in the real world, okay? So I don't want to get too deep into it, okay? And again, a simple definition, what is critical thinking? Well, it's a set of information and beliefs, generating and processing skills, and a habit of using those skills to guide your behavior. I thought that was quite a cool definition, okay? So again, it's a set of information and beliefs, okay? And again, we have to be careful with therapists, with our biases, but it's a generating and processing skills. Now, the processing skills is interesting because when you actually look at the subjective and the objective assessment, and I always say this to the mentorship therapists, like, it's so unfair on the therapist, okay, that you've got initial assessment, 30, 40 minutes, you know, an hour if you're lucky, where you have to get to know this person. You have to build rapport, you have to build authority, okay, you have to get their life story, okay, all of their previous injury histories, their aggravating reason factors, okay, their sin, all of this information, and you have to process all of that information yourself, and then you have to make sense of the symptoms, all in 30, 40 minutes. Especially with complex patients, it's tricky, okay? So that's a skill that has to be developed, okay? We have to connect the dots, and there's stuff that we can definitely use, and I'll talk about that in the coming shows. We go into that a lot in the mentorship and other bits, some exciting projects that I've coming your way to help you with that, okay? But it's actually, you know, it's a lot, isn't it? So it's a set of information and beliefs, generating and processing skills, and a habit of using those skills to guide behavior, okay? Now, when I scroll down this article, they say, well, critical thinkers, they ask questions, okay, so subjective assessment, they gather the relevant information, okay, subjective assessment, probably objective as well, then they think through the solutions and conclusions, okay? Now, I think that's the bit that therapists, we certainly don't do well enough, okay? So we think through solutions and conclusions, and I'll put my hand up for this. There's sometimes where I'll go into a session and I won't think through the solutions and conclusions if I'm tired, if I'm hungover after a big weekend in Galway, okay? I'm only joking, so kind of. So think through the solutions. So again, think twice, treat once. How many times do we really generally do that? If you ask yourself honestly, okay, or are you just going through your go-to solution, every patient that comes in, they get the same hands-on, they get the same rehab exercise, okay? Are you just doing that, or are you actually thinking through this stuff? Now, I'm going to have an episode in the coming months called Second Order Consequences, okay? And that's really, really powerful stuff, okay? I cover that a lot in the second coaching called my mentorship therapist. absolutely critical that we consider the second order consequences of our actions, okay? Because then there's a risk that we do something, we flare the patient up. And again, I'll put my hand up, I've done that many a time, okay? And it wasn't until I actually came across the second order consequences principles I was like, oh, and I cover that in the book as well. It's one of the first things I talk about, page 43 in Happy Progressing Patients, okay? So we need to think through our solutions and conclusions before we act. We've got time constraints. We go through the motions, okay? We gather the information and we treat. We don't think through solutions and conclusions. Certainly I don't do some of the times, okay? I'm getting better at it, a lot better at it. But when I was starting out, I definitely didn't do that. And then we consider alternative systems of thought, okay? And again, in our profession, you have to be careful of the extremists, okay? You have to stay somewhere in the middle there where you have your own biases and you're aware of them, but you can also appreciate other points of view as well, okay? And I'm always very, very wary of someone with an extreme view that's attached to that view, that's emotional about that view. I think it's very, very dangerous, okay? So, but we have to consider alternative systems of thought. So we can't be too extreme, but we have to obviously question, we have to be aware of our biases, but we also have to consider that we could be wrong, okay? And then we need to communicate effectively, okay? Which again, it's something, the communication side of this, it's half the battle. You could have the best hands-on, you could have the best rehab exercises. If the patient doesn't buy in and adhere, then it doesn't matter how good your hands-on or your rehab is, okay? Then they also say they're willing to admit when they're wrong and they don't know the answer rather than digging into a gut reaction or an emotional point of view, okay? And then they talk about 7 habits of a critical thinker, okay? So truth seeking, so they ask questions and follow the evidence, okay? So again, subjective assessment here. Then they talk about being judicious, able to make judgments amid uncertainty. And I think that's really important as well. I'm going to be talking a lot about that in the coming episodes, actually, of this diagnosis approach to assessments versus the Louis Gifford talks about a shopping basket approach, okay? So again, a shopping basket approach where we can actually see what's not doing its job and pick up all of these things, and then we can decide where to treat rather than just being focused on a diagnosis. And there's a lot of times I'll go in, whether it's in the clinic here or whether it's in at the moment with leads who I'm working with, where I'm not 100% sure of a diagnosis, but there's a lot of things there that I'll see that maybe isn't doing enough work, that if we can get it to its work, very often changes the pain experience, okay? So being able to make judgments amid uncertainty, and I think that's a skill we have to develop, okay, and a habit we have to develop. Being inquisitive, so strive to be well informed on a wide range of topics, okay? And that's again what I want to expose you to in these episodes, is actually we need to understand the respiratory, the neurology, the musculoskeletal system, and how all of those link up and they interact, the psychology, all of that stuff. There's a person in front of us, not just pain, okay? So we need to understand that. We need to be confident in our reasoning. So we want to be trustful of our own skills to make good judgments, okay? And again, in order to have confidence, okay, that comes from doing the work. And it's the same with your patients, okay? Especially the last kind of session, I usually kind of break it up around session 6, 7, and 8. It's usually when you get them into that thoughtless, fearless movement stage. Your patient just doesn't wake up one day with thoughtless, fearless movement. They do it through exposure to the loads that they're avoiding or that they're worried about. They usually are rigid when they first do it, and then they start to relax a little bit. They update the belief system, and they start to move with thoughtless, fearless movement. Now, there's things we can do to help that, give the right stimulus at the right time. That definitely contributes to that, but the patient has to do the work. Just like you have to do the work to develop these skills. There's no magic bullet. There's no hands-on technique course. There's no rehab course that's going to give you all the answers. You have to think and you have to solve problems. Then we have to be systematic. So we have to have organized and thoughtful problem solving. Okay, so again, that's another habit of a critical thinker. So we want to have an organized, structured, step-by-step system that helps us think. Okay, and again, that's then the big thing about a structure and a system is it's actually going to decrease the amount of decisions you have to make. Okay, because one of the big things is energy fatigue and decision fatigue. It's real. Okay, that's one of the biggest things that therapists see when they come through the mentorship program, is that they actually go home at night with energy. Okay, the reason that is because they're making less decisions throughout the day, because the structure and the system guides them so they know where they're going and they have to make less decisions. Okay, then we want to be analytical, so we want to identify the potential consequences of decisions. So again, that's second order consequences, page 43 in the Happy Progressing Patients. And then we want to be open-minded, okay? So we want to be tolerant to different views and sensitive to our own biases, okay? Which I think is fair enough. And again, A nice little exercise I'll do now and again is I'll go out into good old Google Scholar or whatever, and I'll try to disprove myself. I think it's a horrible exercise to do. Okay, you're kind of like doing it with one eye open, but it's really, really powerful. Okay, again, if you're so attached and you find that there's an emotional attachment to your point of view, then I think that's a dangerous place to be. Okay, so you have to go and do this exercise. It's horrible. I do it myself, and again, one of the worst things for me is like when I present what I'm teaching in my mentorship to kind of esteemed gurus or people who I respect, and go, okay, this is what I'm saying, this is what I think I'm saying, is that correct? And you're kind of saying, and you're kind of closing your eyes going, oh, please tell me it is, because you know, it's not nice when you find out you're wrong. But again, it makes you better, okay? And I think that's really, really important as well, is that tolerant to different views while we're still sensitive to our own biases, okay? So I thought that was really good. The 7 habits, again, to recap today. Truth seeking, okay? So again, asking the questions. And again, when you're asking the questions in the subjective assessment, go through, you know, one of the best clinical reasoning questions you can ask yourself is, am I trying to solve the true problem or the root problem? Okay. And very often the person who brings the problem defines the problem to be solved. Okay. Shane Parrish taught me that. Okay. And again, the patient comes with back pain, but is the back pain the root problem to be solved? Okay. Very often it's a symptom. Okay. So then we ask ourselves, well, what isn't doing its job? That if it was doing its job, this would no longer be a problem and it would stand the test of time. Okay. And I'll talk about those questions in another episode. So truth seeking, being judicious, okay, making judgments amid uncertainty, it's a skill that we have to develop. Being inquisitive, strive to well-informed on a wide range of topics. And again, for us, you need to understand breathing, neurology, musculoskeletal, psychology, how all of that is going to impact the person. And again, from a resource point of view, I think hands down, Aches and Pains, Louis Gifford's book, is probably the best book or collection of books that I've ever seen to cover all this. And again, you know, how I wrote this book, it's been modeled on how he writes, you know, or how he wrote his books. Very, very easy to read, to apply, to understand. Okay, so I want to give his books a shout out there. They've had a big impact on me. Okay, you want to be confident in your reasoning, you want to be systematic, analytical, and open-minded. Okay, so there are 7 habits of a critical thinker that I think it's going to take time. Okay, it's not going to be something that you can just have a magic pill and it's going to happen. You have to do the work. Okay, now I can give you some shortcuts, okay, with that, and I can help you with that, obviously, in the mentorship. And you know what, that's one of the big things with the mentorship is the mentorship, it's not a course. And the reason it's not a course, and the reason I'm not big into weekend courses, is because this stuff takes time. Okay, it takes coaching, it takes support, and it takes accountability as well on your half. Okay, so we need time to develop these skills, and that's where I can't just have you go through a course and in 6 weeks magically, you know, you're going to be confident, you're going to have clarity, you're going to be a critical thinker, you're going to be able to solve big problems. You need a lot of coaching and intervention, especially when times get tough and it doesn't go according to plan. Okay, and that's where then your clinical reasoning, your critical thinking habits, over time they will develop, and that's where then, you know, you really, really get the benefit of it. Okay, so that's the first episode. Okay, a little bit different. Okay, key takeaways today. I want you to think about these 7 habits. Okay, truth seeking. What are the quality questions that you're asking in the subjective assessment at the moment? Are they giving you genuine, higher quality answers? Okay, again, remember that quote from Tony Robbins, kind of adapted, kind of bastardized. The quality of you as a physio will probably be dictated by the quality of questions you're asking your patients. Okay, and the more complex patients, we have to ask higher quality questions. Okay, again, it's just the definition of insanity. People who come to see me with failed traditional approaches, and they've been to see some really great therapists, you know, am I going to go down the exact same route as those people? Okay, I have to ask higher quality questions to get information that gives me the clues. Okay, then I have to make judgments amid uncertainty, judicious, I can't say that, I'm gone. Inquisitive, you need to be well informed on a wide range of topics. Okay, and again, that's where it kind of ties into your biases as well. Judicious, that's it, judicious. Okay, I must be still drunk from Galway. Okay, judicious, able to make judgments with uncertainty. Inquisitive, strive to be well informed on a wide range of topics. Okay, not just the stuff of our biases. Okay, confident in your reasoning, okay? So you have to trust your own skills to make good judgments. And I'm going to talk about that in another episode as well, as confidence of being actually making a prediction. I'm going to do this and I'm going to see that with a patient, okay? And the more you do that and the more you see it, the more confidence you build. Systematic. So again, organized and thoughtful problem solving, and structure and system really helps with that. Analytical, being identifying potential consequences of your decisions, and open-minded, okay? So again, are you doing all of these things at the moment, okay? Tough pill to swallow, okay? As I said, like it's not easy, this stuff, especially in terms of your own biases and stuff like that. And I'm the same sometimes, okay? So again, in terms of when I go into clubs and stuff like that, obviously, I like to think we think differently. At the same time, there's a time and place for the more traditional stuff as well. Okay, and again, I think that's the beauty of our profession, is there's no one way to get a patient from A to B. Okay, there's a lot of different ways, but I think the clinical reasoning and the critical thinking and the strategy is the most important thing. The tactics essentially will take care of themselves. Okay, but it's the strategy that is important. Okay, that's it for this week. Okay, I hope you enjoyed the first episode. Over the course of the next few episodes, we'll get deeper and deeper into some of this stuff, but this really sets the tone for some of the stuff that we're going to go into in the coming months. Okay, as I said, if you enjoy the show, just share the show. That's all I ask. Okay, so again, share it on your social media if you enjoyed it. Share it with a colleague that you think would benefit from it, or better still, leave a review. If you didn't get anything at all from it, then don't worry about it. Okay. Remember, if you want to ask questions for the Q&A episodes, thegotofysio.com/questions. Okay. If you want to know more about the mentorship, www.thegotofysio.com/mentorship. All that information is in there. And then this new exciting project that we're also working for therapists who aren't quite ready for the mentorship. It's not quite released yet. Okay. But I'm going to send you to a URL if you want to know more information about that, or if you're listening to this at a time when it's released. If you go to thegotofysio.com/members, okay, and then we'll put you on a waiting list there so you get exclusive access to that also. Okay, that's it for this episode. Thank you so much for listening. I'll see you on the next episode. And as I said, develop those 7 habits of critical thinking. Okay, let's have a great week ahead. Let's solve our patients' biggest problems. Let's always strive to give more in value than we take in payment. Okay, and let's change people's lives. All right, I'll see you next week.